We're moving on to more rigid bracing now from the cash brace. We're now moving on to a range of braces which perform similar functions with variations in design. We've got the T34 hyperextension brace with pubic pad. We have the T37 hyperextension brace in all the same ways, except it's got a fixed pelvic band at the bottom instead of a pubic band. Lastly, but not least, we have the T39, which looks exactly the same as the T37, except they've added in an ingenious hinged pelvic section at the bottom so that the pelvic section will give the support but rotate as the patient sits to stand to give more comfort. I'll go through the braces for you. The braces are all of the same level. They're all designated to be T6 L3 controlling braces. The biggest difference over the cash brace, or the cruciform brace we saw earlier, is the fact that there is a high level mediolateral locking of the spine as well. Before it was anterior posterior extension control. This has all those features, except it's also going to totally lock out that anterior posterior and lateral bend as well. So that totally locks that up. This is, again, falls in the category like some of the other bracing in the sense, but is very, very effective with stable compression fractures, osteoporosis, post-surgical support. Comes in a range of sizes from small to extra large. So there's a vast range of sizes that can be ordered for this. The ordering situation is it goes on a circumference of the hip measure. And as you can see from similar with all the bracing on the same range, there is a vast amount of adjustment in the mediolateral control that can be achieved by undoing the screws, using the sliders to slide the bars out from that particular point of view, and you can adjust the position of the side strap in different holes up and down as well. The liner is a Velcro patch in liner, and it is available to buy refurbishment spare kit to go with this. The plate itself is malleable to gate some adjustment over the suprasternal notch area of the sternum itself, and the sidebars can actually be adjusted to suit the patient for locking. The side fastening is on, once it's adjusted, there is a quick release pressure clip. So effectively the patient wants to take the brace on and off. You've gained compression within the brace, anterior posterior, between the pads to stabilize the posture in the hyperextended position that you want. You then want that to be released. So there is a pull toggle lever here, but that can be, obviously once it's under pressure, difficult to disengage. So what you would do is you would unclip, there's a sort of lever lock system on the side. That would be unclipped first, and that, the reason for that, it would lengthen and slacken off the strapping so that then the side strapping on a pull toggle can be pulled and lifted out, as we can see. And the reverse can happen. You would fasten the toggle back in first and then lock up the brace secondary after that way, once all the adjustments have been made by the orthotist or the practitioner or team that's actually fitting the brace to the patient. The reason for the differences in the brace is not control particularly, it's more comfort level down at this end. This is much more useful on a lean patient with good musculature. The pubic pad would lock on and stay in place quite nicely and give a comfortable pressure. The larger the BMI weight of the patient, the more things become that you need more and more adjustability into it. Some patients would find the pubic pad not as comfortable as other patients. It becomes a personal choice, and then there's the full band to give and load that pressure over a larger surface area. You're still getting the same control. Once the patient becomes larger, the issue can become in soft tissue, stomach coming out over the brace and creating discomfort because the brace obviously creates pressure anterior posterior. Once it's fastened, they can bulge out of the brace and get discomfort from these areas here. So this is where the rotating pad area comes in to give some glide movement on that. Sometimes the glide movement and the pump action of the pad can make the brace feel as though it's migrating up the patient a little bit, in which case we're moving to the other braces. It's a professional choice at the supply point. It's not, the company is giving 3 options on the brace, on the use of the brace and how the brace is used and the fitting of the brace. The choice of which type of the bottom end really is the difference between the braces. As you can see, the pubic end is the difference between the brace. That is from a professional point of view, from the person fitting the patient and what the patient obviously is presenting with. So you can choose the option to get round that. In many instances, the hospitals would often keep one of each styling just to see what worked, or from experience of fitting the brace, they would instantly become aware the markers for the patient. They would instantly know after a little bit of experience fitting the brace, the markers would be there that you'd default to brace A, B or C to achieve the most desirable fit for the patient with the most chance of success. The brace can be adjusted, as I mentioned, in various ways. Width-wise on the screws, set this, you can widen and narrow the brace itself. And you can see from the screws on the side, you can actually lengthen and shorten those overlapping cantilevers on the side of the brace itself. So you can slide the brace longer or shorter to suit. Top and bottom for width. Sides can be adjusted for adjustment up and down for length.